Today, we're diving into a real medical mystery. It's about a rare, enigmatic disease that actually turns the body against its own vital arteries. A condition so strange, it's famously known as the pulseless disease.
Just think about that for a second. What if the very system designed to protect you, your immune system, suddenly went rogue and attacked your body's biggest, most important highways? Not some outside invader, but an attack from within. Well, for patients with Takayasu Arteritis, this isn't a what if, it's their reality.
All right, let's get right into it. Our investigation starts with this truly perplexing condition, one that earned its nickname for a very unsettling reason.
So what exactly is Takayasu Arteritis, or TA for short? Well, at its core, it's a type of vasculitis. Basically, it's an autoimmune disease where the body's defenses get confused and start attacking the aorta. That's the main artery coming right out of your heart and all the major branches that stem from it. And what's really interesting is who it tends to affect. Overwhelmingly, it's young women, usually in their 20s and 30s.
You know, this isn't some new mystery that just popped up. The clues have been slowly pieced together for almost 2 centuries. Way back in the 1830s, a doctor wrote about a patient with a fever who, well, he lost the pulse in his arms. But the real breakthrough came in 1908. A doctor, Mikito Takayasu, presented the case of a young woman with weird vision problems. And right there, at that same meeting, his colleagues started chiming in, connecting his findings to their own patients who had pulses that had just disappeared. The puzzle pieces were finally starting to fit.
So just how rare is this disease we're talking about? Get this, in North America, we're looking at about 2.6 cases per million people every year. That's it. And that extreme rarity is a huge part of the problem. It's why it's so hard to diagnose and why there are so often delays.
So the big question is, what causes the body to launch this kind of internal assault? The truth is, the exact trigger is still a mystery, but investigators are zeroing in on 3 main suspects.
First up, genetics. We see this disease more often in people of Asian descent, and scientists have found specific genetic markers, like one called HLA-BW52, that are way more common in Japanese patients. Second, the immune response itself. TEA seems to be linked with other autoimmune diseases, like lupus, which really suggests there's a common glitch in the immune system's wiring. And last but not least, you gotta look at hormones. I mean, the fact that it hits women 6 to 8 times more than men, usually right in their childbearing years, that's a pretty big clue that hormones are playing a role.
So what does this attack actually do to the body? Well, think of your aorta and its main branches like a huge national highway system. In TA, the immune system isn't just attacking the cars, it's attacking the road itself. The walls of these arteries, the pavement, start to swell up, thicken, and crack. This causes these massive traffic jams, which doctors call stenosis, and in other spots, the walls get weak and bulge out, creating these incredibly dangerous weak spots, or aneurysms.
Now, there's a technical name for this kind of all-out assault, pan-arteritis. Pan meaning all. This tells you the inflammation isn't just on the surface, it goes deep through all 3 layers of the artery wall. It's this deep, destructive attack that leads to all the thickening, the scarring, and eventually the narrowing that chokes off that vital blood flow.
Okay, so if this is what's happening inside, how on earth do doctors even begin to crack the case? Well, let me tell you, the investigation is not easy.
And here's the heart of the problem, summed up perfectly in this quote. The early symptoms of TTA are just so vague. We're talking fever, feeling tired all the time, muscle aches. I mean, that could be anything, right? It could be the flu. This is exactly why there's almost always a major delay in getting a diagnosis. And that delay has a real human cost. Think about this. On average, a patient will see five different doctors before they finally get the correct diagnosis of Takayasu Arteritis. Can you just imagine the frustration of that journey, going from doctor to doctor, year after year, with no answers?
And just to make things even more complicated, the disease doesn't even present the same way all over the world. It's wild. In the United States, in 80% of patients, a doctor might hear something called a bruit. It's a whooshing sound from turbulent blood flow. But in India, the most common sign is high blood pressure. So this geographic variation just adds another layer of complexity to an already very tough puzzle.
So how do doctors finally get there? The journey usually starts with those vague symptoms. Then, maybe some blood tests show high inflammation levels, but again, that's not specific. The real aha moment, the breakthrough, usually comes from advanced imaging. Things like an MRI, a CT scan, or a PET scan can actually let doctors see the inflammation and the thickening in the artery walls. That's the hard evidence they need to finally match it up against the official criteria and confirm the diagnosis.
So, the verdict is in. The diagnosis is confirmed. Now, the fight begins. The main goal is to slam the brakes on the immune system's attack and try to manage the damage that's already been done.
The first line of defense is almost always high-dose steroids like prednisolone. They're great at knocking down that inflammation fast. But here's the huge challenge. Relapse is incredibly common. Some studies show it happens in up to 96% of patients. So doctors usually have to add other immunosuppressants to the mix to try and keep the disease in remission. And for the really tough, stubborn cases, they bring out the big guns, newer biologic drugs that target very specific parts of the immune system.
Now, when those arteries get too narrow, you have to go in and reopen the highway. There are two main ways to do this. You can do an endovascular procedure, like putting in a stent from inside the artery, or you can do traditional open surgery to build a bypass around the blockage. But here's the crucial part. While the endovascular route is way less invasive, a huge analysis found it has a much higher risk of the artery just narrowing down again. That's a problem called restenosis. In fact, the odds were over 5 times higher compared to open surgery. That's a pretty big deal.
And that brings us to the long-term outlook. Takayasu arteritis isn't something that goes away. It's a chronic, lifelong condition. So, what does living with this verdict really look like for a patient?
Well, the numbers here tell two very different stories. The overall survival rate at 15 years is about 83%, which honestly is pretty encouraging. But, and this is a huge but, for patients who develop major complications, whose disease keeps progressing, that 15-year survival rate plummets in just 43%. It just goes to show how absolutely critical it is to get the disease under control and prevent that serious damage.
And at the end of the day, the biggest threat often comes right back to the heart. All that constant inflammation, the high blood pressure, the damage to the aorta, it all puts an incredible strain on the heart muscle. And because of that, the most common cause of death for patients with TA, no matter where they live in the world, is congestive heart failure. Which leaves us with this final, massive question. Right now, we have treatments that can manage the flare-ups, but they often have serious side effects, and the disease just keeps coming back. So the real challenge, the whole future of research in this area, is figuring out how we move beyond just putting out fires. How do we stop the attack for good? How do we achieve not just remission, but a true, lasting cure?